in the setting of where the maternal fetal community is with advanced imaging, first trimester diagnoses are becoming more and more frequent in this the genetic testing world and the prenatal screening aspects of just amazing sensitivity and specificity that we're getting much earlier on in the pregnancy now. It is definitely something on my mind, the earlier diagnoses, earlier counseling, referrals into fetal centers much earlier. And I think that that's an important flag for the obstetric community in general, right? Because we want to be able to serve these families early. We want to be able to have discussions about options as early as possible. And we want to be able to support that family through whatever decision they make in their pregnancy. And so I would say, yeah, first trimester diagnoses, that's a big one this year. It has been, but it's developing more and more. Yeah, I agree. I think it is a multidisciplinary family, right? And really that's what we're serving to our patients and to the expectant family too, right? So I think that the incorporation or early involvement of that specialty, multidisciplinary discussion, regardless of the diagnosis, whether it is life limiting, whether it's a chronic illness, whether we're concerned about the outcome immediately or long term, we can have those discussions in that expert fashion with other disciplines, and we should be having those early on so that we can help families think through next steps, and then begin with our obstetric colleagues birth plans and birth planning and next steps depending on what exactly the gestational age is and where they're at with their decision making. My brain immediately, and my heart, right? It goes right to psychosocial intervention and support for families. And I think that this answer is going to differ depending on who you talk to. And I fully support that too. But I think in my area of focus, having some psychosocial support intervention studies for families that are undergoing fetal intervention, fetal diagnosis, life-limiting diagnoses, and also even those families that are going through a bereavement process. We really need to get better in screening these individuals, in incorporating psychosocial measures into our studies for interventions. You'll see, even in the original FETO studies, there was 1 or 2 psychosocial questions given to the families, and those are out there, but we really need to kind of hone in on what a family individually needs now and how we can intervene and actually have outcomes that are measurable. And I think that that's going to be, the patient recorded outcome measure kind of field of study within fetal intervention and therapy. That's really what I'm excited about and what I'm looking forward to over the next couple of years.